Hello, this is a very small presentation on endo perio lesions. The whole idea of this presentation is let the viewer understand what endoperio lesion basically is. There is a brief classification in the further slides. We'll also discuss about the treatment modalities for these endoperio lesions in this presentation. Now, what is an endoperio lesion? An endoperio lesion is basically a lesion that shows dependent and or independent involvement of the pulp or the pulp space in the case of endodontically treated tooth and periodontal tissues of an individual tooth, regardless of the etiological factors, pathological patterns, or the treatment approach. Now, what are the etiological factors or the factors that contribute to the development and progression of endoperolation? Microorganisms, trauma, root resorptions, perforations, and dental malformations are the various etiological factors that can lead to these lesions. Now, there can also be weak communications like pathological communications into which microorganisms can uh, multiply and cause these lesions to develop and progress. Now, what are these pathological communications? It could be developmental or non-developmental. Developmental as in palato-gingival grooves, facial radicular grooves, cemental hypoplasia, cementum-like radicular invaginations, dental dysplasia. These are the various developmental communications. Non-developmental being disease, trauma, or iatrogenic procedures. Now, what is the widely accepted or generally accepted classification for endoperio lesion? It was given in 1972 by Simon et al. And the classification basically goes by this format. Primary endodontic lesions with secondary periodontal involvement, primary periodontal lesions with secondary endodontic involvement, or they could be true combined lesions. Now, if you have these lesions, these endoperio lesions, then the initial considerations for these lesions is to consider the prognosis. Now, if the tooth can be restored, and then make a proper diagnosis and assess the degree of healing, which will determine the further management. Now, if there is a primary endodontic lesion, then the goal is only to perform a endodontic therapy. Now, what if there is a primary endodontic lesion that has a secondary periodontal involvement or a secondary periodontal lesion, or what if there was a true combined lesion? Then, first you have to perform an endodontic procedure or a root canal treatment with simple hygiene phase. This root canal treatment has to be done in multi-visits with the use of intracanal medicaments. Evaluation is done in 2 and 3 months. If required, we perform further periodontal therapy, and in case of true combined lesions, look for iatrogenic damage or fracture or perforation. And these iatrogenic damages have to be managed. Like you have to seal the perforation with materials like MTA, EBA, GIC with trimmer, or manage root fractures efficiently. Now, if there's a periodontal lesion which is primary, then the goal is to only perform a periodontal therapy. Now, if there is a periodontal lesion that has an endodontic involvement, then regenerative procedures have to be done like a GTR procedure, and then prior to surgery, palliative periodontal therapy has to be carried out along with root canal treatment. We reevaluate for 2 to 3 months, after 2 to 3 months, I'm sorry, and then look for periapical resolution if there is resolution or not. Now, if there is resolution, then look for mobility, and if the mobility is greater than 1 mm, splinting has to be carried out. If there is no mobility, then pockets have to be assessed. If the pocket is less than 4 mm, a non-surgical maintenance phase would do. If the pocket is greater than 4 mm and less than 6 mm, then osseous surgery has to be carried out. And if the periodontal pocket is greater than 6 mm and there is a deep defect, then GTR procedures have to be performed. Now, there is no periapical lesion, and if the prognosis is hopeless, we go ahead with extraction. Or if there is a borderline prognosis, then and with one single root being unaffected or with no underlying lesion, then procedures like root resection or bicuspidization, hemisection can be carried out in multi-rooted teeth. Now, that ends my presentation on endoperio lesion. Like I said, this is a very brief presentation on this lesion. I hope I made it a little interesting and knowledgeable. Thank you.